ABC News contributor and epidemiologist Dr. John Brownstein for more on this. Dr. Brownstein, the White House deemed COVID-19 a public health emergency 13 days after the first case confirmation. So why did it take over 2 months for this White House to declare monkeypox a public health emergency?
Well, Diane, that's a really good question. We're seeing history repeat itself. Many of my colleagues have been sounding the alarm for months, and public health is, at risk of being caught flat-footed again. It's possible we saw this more as a local issue than a national crisis, but when you have over 7,000 cases, we need to deal with this at a country level. We need resources on testing, tracing, vaccination, education. And we're finally seeing the federal government ramp up the response with appointment of key officials, a rollout of vaccines. But we have a short window to act here. This is an issue where a virus could become endemic and something that we have to deal with for years to come. Unfortunately, public health response, again, has been slow, but we do have a window to make a real impact here.
Now, the FDA is reviewing a new approach that could lead to they say, a 5-fold increase in the nation's supply of the monkeypox vaccine. What do they mean by this new approach? They say a smaller, shallower injection.
Right. So the idea is, how do you make supply last longer, get it to more people, given the massive amount of demand? So you'd be using the same vaccine, but a smaller, shallower injection under the skin. That's known as an intradermal injection. If approved, it would be 1/5 the dose and could, of course, increase the number of people to get the vaccine 5-fold. This wouldn't actually be the first time. If you remember the H1N1 pandemic, we used the same approach to get the supply out to more people. This would still be a 2-dose vaccine, so it wouldn't be just this one shot. But the concern is, of course, this is going to require more training on the part of public health and providers to know how to administer this vaccine, though it is the same test way that we apply the tuberculosis test. But for now, it's just a proposal. And so there's lots to do in terms of testing and understanding whether this could be actually rolled out.
All right, Dr. John Brownstein, great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.